Angelina Jolie is once again back in the headlines because of her health. The 42-year-old actress revealed to Vanity Fair that she suffers from Bell's palsy. She says it appeared in the years since her split from Brad Pitt, and that acupuncture helped her to make a full recovery. Well, this has got a lot of people asking questions, specifically, what is Bell's palsy? So now we're talking to Dr. Hamid Kadiwala, a neurologist from Texas Health Fort Worth, and we thank you so much for joining us this afternoon to help us understand what this is. So can you break down simply what is Bell's palsy?
Sure. You know, the way I like to think about it is basically we have our brains and we have the nerves that come out of our brains, the peripheral nerves. So the head itself has a special set of nerves called the cranial nerves. There's 12 of them. The 7th cranial nerve is the one that supplies the face. So whenever you have damage to that, for whatever reason, which we can discuss, that person, instead of smiling, instead of raising their eyebrows, reacting, now they're going to have a facial droop. Their eye might droop. They might not be able to close their eye. It's pretty dramatic when you see it.
That's that paralysis that we're talking about.
Yeah, that's the paralysis that we're talking about.
So let's go into what causes this to even happen.
Yeah, so unfortunately, we're not 100% sure. But other than the obvious of maybe like a tumor or some type of external compression on that nerve, our thoughts really surround or circle around viruses, actually specifically herpes simplex virus. So the thought is that it resides inside the nerve, and then for whatever reason, it comes out and attacks.
Interesting. Yeah. So we know that Angelina Jolie's situation sort of occurred or manifested while she was separating from her then husband. So I guess people are maybe questioning, is this at all stress related? Could it be potentially? You know,
I'm not sure about the relationship with that one specifically, but as far as stress, it's anything that can cause a relative immunosuppression, if you will.
Okay.
So stress, I've seen that in the past. That, I mean, nobody can really specifically pin it down to that, but that's definitely a possibility. Relative immunosuppression, diabetes, for example, even pregnancy, the last trimester, where women tend to be less, their immune system is not as strong. All these things, all these situations can actually cause that problem to come out.
Wow. So when exactly is it time to get treatment for this sort of thing, and what are those treatments?
Sure. It's a good question. So whenever something like this happens, right away. So if you see that, you want to go to the hospital and have a professional look at it. And really the treatment encompasses two major things. One is medicine. So for example, where we give steroids and an antiviral because there's a presumed thing that this might be HSV. And the second thing is to deal with the consequences. The major consequence being that this person, they can't close their eye, right? So we don't even think about it when we blink. But so they can't blink anymore, so they have to make sure to keep their eye moist. When they're sleeping, when they don't even have that ability to remember that, we actually tell them to wear a patch or tape their eye so that they don't do any further damage like corneal damage or anything like that.
In Angelina Jolie's case, she says she used acupuncture to help her actually recover, I believe, completely even. So it is possible then to recover from this?
Yeah, actually, so about the majority of people, about 80% of people will recover from weeks to months. And even less than that, a few, the rest of the remaining population, they tend to get better too. Maybe sometimes it's not a complete recovery, but the majority of the patients I see, they do quite well.
Well, that's good to hear. Yeah. Really interesting information. Thank you so much, Dr. Kadiwala, for joining us this afternoon and shedding some light on this topic.